Republican leaders announced Tuesday they are working to override the governor's veto of House Bill 2. The bill compels the state to join a multi-state lawsuit challenging the federal health care reform law.
We have a number of friends in the Democrat caucus, and I think that it's obvious that there's a political game being played here. It's not the substance of the bill that's at question.
Republicans need at least 4 Democrats in the House to join them in voting to override Perdue's veto. Representatives William Brisson and James Crawford originally voted for the bill. Americans for Prosperity is targeting at least half a dozen Democratic lawmakers who may support a veto. Republicans are also debating how to implement the bill in the states by creating health benefit exchanges mandated in the federal health care reform law. The House Health and Human Services Committee is discussing how to establish the exchanges. Representative Jerry Dockham introduced the bill to create them.
I think it's wise for us to go ahead and be ready in case it does come to the point where we have to implement these exchanges.
Legislators almost universally worry interaction will allow greater intervention by the federal government. Joe Coletti is Director of Health and Fiscal Policy Studies at the John Locke Foundation, publisher of Carolina Journal.
For states to go forward and try implementing an exchange cedes too much constitutional ground and too much of the ground to challenge the federal law.
He also says a loophole in the federal law may allow the state to escape having an exchange altogether.
If the federal government sets up an exchange, there is no reason for the state to automatically give licensure to a company that is participating in that federal exchange.
North Carolina Commissioner of Insurance Wayne Goodwin is pushing for an exchange, but he is also pushing to protect his office's regulatory authority over insurance. Healthcare expert Ed Heiselmeyer at the Heritage Foundation agrees an exchange should have little power.
The defensive way to do this is to essentially neuter the exchange of any regulatory power, keep all of that in the state.
Leading the effort of Democrats is Representative Verla Insco. She says an exchange should regulate the insurance companies.
If you put a board in place and deny that board the right to do those standardizations, then we're really going to just continue with the same kind of marketplace we have now.
The final say on when an exchange will be created will likely come from the United States Supreme Court when it rules on the constitutionality of the health care reform law. But there's no telling when the court will take up the case. For CarolinaJournal.tv, I'm Anthony Greco.